All right, so today is or this evening is the Mblex review. Gonna try and go over a couple of things with you guys. Again, this is kind of what we call like a throwaway presentation because maybe some of the stuff I said is on the Mblex and maybe none of the stuff I say is on the Mblex. The past couple of years they have updated it, and sometimes they will make a change and they'll give you different options for the test. It may be more anatomy, it may be more pathology, it may, go either way. But hey, we call it a throwaway. I'll give you some information. You guys, um, get to, let me just open this up a little bit. You guys get to look at, some of the material, go over some of the material, what you don't remember, and then you spend more time on that. What you do remember is what you spend less time on. So just keep that in mind. Can everybody see the screen?
Yes.
Right. So as you see on the screen, it dictates the percentage of what's on the exam. So the anatomy, the physiology is 12%, kinesiology is 11%. And let me just bring this down here, make sure I got all of that. Oops, come back up. The pathology, the contraindications, the area of caution, special population is 13%. The benefits of the physiological effects of techniques that manipulate the soft tissue is 14%. The client assessment, reassessment, and treatment is 17%. And the overview of the massage and bodywork modalities is 5%. The ethic, boundaries, and laws and regulations is 15, and then the guideline for professional practice is 13. So if it's 100 questions on this exam and they're breaking down the percentage based on 100, then anatomy and physiology here would be 12 questions. Kinesiology would be 11 questions. Um, then we look at the pathology being 13, the physiology effects and techniques would be 14, the client assessment, reassessment would be 17, and so on. So, in some cases, yes, this is the breakdown by the FSMTMB who developed these tests, and like some of your classmates, let me- my screen is black. It's still black because I know I had some Wi-Fi. Let me get out of here. Let me see if I can bring it back. Is it still black? Can you see it now? Or no? Let's see here. Okay. Is it just Johnny that's black, guys? Can everybody else see it? Just let me know so Kamel can see it. All right. Johnny, if it's still black throughout the whole presentation, let me know. Um, so what I'm going off of is the FSMTMB sheet that showed the percentages, Johnny, that I handed out. If you want, you can leave the room and come back and see if it updates the screen. So again, like I mentioned, it can throw you if you ask any of your classmates that have taken the test. Sometimes it's more anatomy, less anatomy, more ethics, less ethics. So they can throw it around. They have four versions of this exam. Um, and we just need to be aware of how you want to break this down and how you want to study this to use this sheet. So with the anatomy and physiology section, it's talking about the systems. So for those guys that have taken anatomy and physiology um, outside of this course, then you would just have to go back into the the systems of the body and understand the circulation, the digestive, the endocrine, lymphatic, muscular, reproduction, skeletal, and then also the systems function. And then we also have the tissue injury and repair and the concept of the energetic anatomy. So, like Chinese medicine and those things. So you just have to use this study guide, and I like to just say put a check on what I don't know, and probably put a circle on what I need to come back and review. After this course, I'll put a book in your in the chat, which is it's 1,000 questions. So over 1,000 questions. It's a review book. I'll put it in the chat, give it to you guys as a gift. So you guys can look at it if you need to cover more about this exam. All right. Let's get out of here. And let's go over the first. Welcome, welcome, welcome. And let's get. Oh, I'm gonna have to share a screen on that one. Give me a second. Hopefully I could bring this over here for a second. Let me see how I can do this. All right, so here we're gonna go over a little bit of this Mblex review, and all right, so here it talks about the FSMTMB. Some of the stuff I went over with you guys last semester. Um, is a governor body who develops this test that you guys are currently going to be sitting for in the next couple of weeks. And here are some of the review material that we have in the link. For the most part, you guys are, in my mind, pretty much prepared for the exam. If you have the app, the the AMTA app, you have your Trail Guide to the Body app. It's pretty much if you just hit that every day. I like to say if you have 3 weeks, 3 weeks prior to the exam, get yourself prepared for that. Do something every day. Don't overwhelm yourself. Um, Again, if you're doing very well on the app, and some of these questions, some of the review questions in the book that I'm going to send you guys, and you briefly just go over your Tappins book. Spend some time on the business section in the Tappin books, because there's going to be a lot of business questions. Um, Hopefully, we can cover a majority of what's covered in that. But gather all your review material. Don't overwhelm yourself. Um, give yourself about 3 weeks prior to the exam. I like to say three, because once you go 4 or 5, 6 weeks out, then you're kind of just going to get burned out. And then there might be a couple of questions on the exam where you just say, where did that come from? It came out of nowhere. So give yourself 3 weeks, so that while you're cramming for that exam, it kind of leads into taking that test. All right. So here it just explains the content that we just went over. Um, what information is covered in the licensing exam. Um, so if we take a look at the general education, and we talked about the first part, the human anatomy, physiology and the kinesiology prepares the students to understand the benefits of massage and lays the foundation for the following category. So when it comes to the anatomy, physiology, and kinesiology, the kinesiology aspect of it is understanding the movement, like flexion, extension, internal, external rotation, transverse plane, um, sagittal plane, frontal plane. A lot of those things you're going to have to keep go back and kind of remember that. As far as the clinical pathologies and indications, contraindications, a lot of that stuff you guys pretty much know, um, because it's the things that we can do for to do the massage and the things that we can do if they're present on our clients as far as the massage application. So um, here again, understanding the human anatomy, physiology, the kinesiology, the clinical pathology. Some of the pathology is heavy there, so if you can use those the cheat sheets that one class that I taught. I think I have the other one. I thought I gave it to you guys, but that can help you as well with the pathologies too. All right. The body work, the application, what methods are used to obtain the database, like the SOAP notes, um, competencies, um, where to apply the appropriate methods, the safe way. So even a lot of the questions will be about, cleaning your table, sanitary. Um, a lot of questions will be on that. So spend some time. The Tappan's book covers a lot of information. So the poll with, I would say, the last 5 years, 6 years, a lot of the students use the app, the Tappan's book, um, are the first two ones, and then they also do the little practice exams in any of the material that's available out there. I would say don't spend no more than $30 if you want to, on study material, because everything is there. Um, and that's basically it. Those three things. I mean, the tap-ins, the app, any study material that you can get for free, and that should cover pretty much everything that you need to know for this Mblex exam. All right. Professional ethics, the business practices and wellness practices about I don't know if this is accurate to what we looked at. I have to look back over. But the professional standards and ethics, the business practices. So there's going to be a ton of questions on, you know, if there's a relationship between the massage therapist and the client. Is it appropriate to do the massage? Things like that, where it's common sense. The answer will stand out right there for you guys. Um, let's make sure. Oops. Let's make sure that I got it. All right. So the first thing I like to cover, just again, this is a refresher. I know for some of you guys already know this stuff, but it's just to refresh, your memory. So the body mechanics. So if you take a look at the body mechanics, um, you can see here in this picture A, you have the center of gravity, you have the foot that's stabilized, the weight bearing foot is in behind. If you look at picture B, um, let me just make sure. I don't want to be talking and you guys can't see anything. I just want to make sure you guys can see. Oops, oops, there we go. All right, if you go look at the picture B, the application of force is with the hand on your client, the joint stacking with the elbow, the shoulder. Um, you'll see the back weight bearing the forward foot, and C is showing the same thing, and then the core stability. So that's the proper body mechanics when we're looking at from the normal stance. So here, it just shows you the fundamentals of the body mechanics is to begin, lean, weight shift, stabilize the joint stacking, um, glide when the weight from the back of your foot moves forward, from the heel to the ball of your foot and your toes. It's time to reposition and take a step. So the body mechanic questions will talk about the weight shift, the center of gravity, the application of force, whether it's the hand, the elbow, the fist, um, where the foot should be, where the weight bearing foot should be in the back, and go over some of that stuff. All right. As far as the application of force, so as you guys know, we have compression. You'll see here the tissue. A2 is the tissue and the bone, and the compression is the force that's going down into the tissue. Then we have the tension. The tension is going away, like in opposite directions. You have the arrow going to the left, and you got the arrow going to the right. And then if you look at the bending, so bending is kind of like a little bend on the tissue, and it's going like in the downward position. Like if you're working on the traps and you have two hands on the traps and you're kind of bending the traps and you're going in the opposite direction with the traps. The shearing, shearing is, where we can do the cross fiber friction on the back where you kind of going up, going across at that horizontal angle where, one hand goes in one direction, the other hand goes in the other direction. All right. So this terminology where when we look at the application of force, these are the terminologies that you guys are going to see. So compression, tension, bending, shearing, torsion, like the twisting. If you had the gastroc, you'd be using the torsion. All right. So please pay attention to the aspect of that. All right. Let me make sure. If you have a question, just put it in the chat and I'll come back and read it. All right. So the manipulation. So this is the part of your hands on the soft tissue. All right. So as you can see here, we have the resting position. When the massage begins, it's very important for initial contact to be made as with respect to and a client to center the force. So you guys remember in the beginning of the semester, when we first learned our massage, we started off with the resting position. So that we also called like centering and kind of preparing yourself to start the massage. All right, so with holding the resting position, we enter the client's personal boundary and space. All right, so once you start the massage and you're starting to apply your treatment aspect of it, you'll see here this is the gliding strokes. So gliding strokes are historically known as effleurage. So you may get the question that would switch up gliding stroke and they're talking about effleurage and you're kind of trying to figure out what are they talking about. Sometimes these terms are interchangeable. Um, if all right, so which originates from the French verb meaning to skim and to touch lightly. So effleurage is obviously what we use to warm up the tissue. It's used as a transition in a lot of our techniques when we're massaging. You'll see here that it's the most superficial application of the stroke to do. In the full spectrum is to determine by the pressure, drag, speed, direction, and rhythm, making this manipulation one of the most versatile. So you can go at a tempo when you're doing the effleurage. You can go slow. You can go fast. You can change the direction from the heart, going back down to the feet. So like it mentioned, it is a very versatile stroke um, in what we do in massage. But keep in mind, gliding strokes is another terminology known as effleurage. Hint, hint. All right, kneading. Because the skin and the underlying muscles cannot be lifted, kneaded without first pressing into them. Compression with the gliding stroke should be done before kneading begins. So, of course, we have a way of applying our treatment. We always want to start with effleurage. In some cases, some people start with compression, then effleurage, and then they go into the kneading. But remember, the terminology, just like gliding strokes was for effleurage, kneading is another um, terminology used for petrissage. Hint, hint. All right, so you might be reading a question and it just says kneading, 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 and you'd be like, I just can't understand what they're talking about. It's used interchangeable with petrissage. So this historical term for kneading is derived from the French verb pétrer, meaning to knead. The soft tissue is lifted, rolled, and squeezed during an application. So that last sentence looks pretty familiar. Can't tell you where I've seen it. The main purpose of this manipulation is to lift the tissue while applying a bend, shear, and torsion force. So this is kneading, also known as petrissage. All right. Here's another terminology that we use, skin rolling. So skin rolling is one of the very few massage methods that is safe to use directly over the spine because only the skin and superficial fascia are accessed. The direction of pull of the tissue is up and away from the underlying bone. The spine risks no injury, unlike when any type of downward pressure is used. So when we look at skin rolling, the question is not going to say skin rolling. The question may have this technique. There's no risk to the spine, no injury to the spine, and does not use any type of downward pressure. So it kind of it's going to play around with you with the question, what's in the question, and you're going to look at the choices, and you got to understand. Okay, kneading has to do with petrissage. So that's elimination. Compression is, pressing down. So you're going to have to do process of elimination to determine what's going on with your choices. So spend some time, go over that. Like I said, you shouldn't be spending 20, 30, 40 minutes on understanding these terminologies. Here you'll see an example of compression. The elbow is being used and the fist is being used. Okay. And here is vibration. And then we got topoduments. All right. I'll just spend some time going over that. All of that information is in your Tappins book. All right. All right. So some of the modifications that we as massage therapists that we use, if you look at the title here, massage modification and adaptation. So it's always going to fall into where we're providing the massage and if our clients need any, adaptations to what the situation is going on in reference to them. So one of the things that we do use is chair massage. So we can use a chair massage and not the table. Another option is to use the floor or a mat. All right, so you got the mat massage where you could put your client on the floor, and then if you do have a large client, you can have them on the floor as well if it's uncomfortable being on the table. All right. Some of the modalities that we can use with our client is hydrotherapy. So you can see some of the things that we can use: cryotherapy. Um, we can use the bath if need be. So these are all forms of hydrotherapy, um, which is another form of adaptation and modalities that we can use. All right. So here, box 3.1 talks about the therapeutic uses of water. Um, this is an important box. So I'm gonna get this to you guys so that you guys can overview this. But this, if you just review this box 3.1, this is gonna help you tremendously from reading tons of pages in that pathology book, which is our favorite book to read every day. Um, but here it just helps you out with the therapeutic uses of water. Um, so we got analgesic, relieves pain. Um, Anesthetic, reduces sensation. If we come back down here, antispasmodic, reduces muscle spasm. Burn treatment, first degree and mild second degree burns only. Let's see here. We got laxative, promotes peristalsis of the bowels. Stimulant increases sympathetic arousal. Tonic increases muscle tone. Um, and I believe here it's just linked to this hot warm cold application code. Yeah, so over here is just linked to what's over here. I'm going to tell you this box is very important. All right. Classifying the water temperatures. So this is as well. Box 3-2. Very cold. We know that 32 degrees Fahrenheit is painful. Cold, 56 degrees Fahrenheit to 65 is uncomfortable. Cool, 65 to 90, 92, give you some goosebumps. And then neutral. So normal skin temperature, we know it's that 92 to 98. You will see probably one or two questions on, this water temperature. All right, so rolling on to the pathologies. So we'll see here, this is one of the pathologies, which is reflexology. So when it comes to the pathologies, the goal here, as when you're reviewing this information, is to understand the differences between each pathologies. And we'll get into a little bit more detail about the types of pathologies that are out there. Now that we're going to get roll into the business stuff, you'll start to see, okay, wow, there's this, that, this, that. There's plenty of pathologies, but just understanding the difference between each pathologies, you should be good with that. Obviously, some of the questions are going to go a little bit more in detail with the pathologies. All right. Sanitations and standards, precautions. Again, you're going to have questions on this for sure. And this is just the hand washing. Let me go back here real quick. I'm just going to try and zoom in. But with the hand washing, the correct, techniques, turning on the water, wet your hands with forearms and elbow, clean underneath your fingernails, um, soap your hands, rinse your hands thoroughly, dry your hands, and turn off the faucet. So these are some of the steps, and to washing your hands. And then these are the standard precautions. So for you guys taking that class, you guys know that you have to do that glove, taking off the glove example. So this is the proper removal of disposable gloves. All right, by pulling off one glove, putting the removed glove in the palm of the gloved hand, removing the other hand, and then first remove the glove inside, disposing of the used glove. All right. So here's some of the common aesthetic techniques for preventing and spreading the pathogens. Um, Sterilization. So again, you will, if you look at that chart um, that we talked about in the beginning, it gives you a detail of what you need to look up um, when you're studying for the test. So it talks about the pathogens and whatnot. So sterilization, destroy all organisms by means of heat, pressurized steam bath, extreme temperatures. You'll see disinfection, destroy most pathogens, but not necessarily all microbes. Um, and then isolation separates potential infections, individuals, or materials from uninfected individuals. All right, another area of the exam is assessment and treatment and care plan development. So here's the pain assessment, the pain scale. Um, I know they have a lot of questions on this as well. So usually we ask people on a scale of 1 to 10, how do they feel? So you'll see here, this is A is the descriptive pain intensity scale. Right here where it says none, slight, mild, sorry, moderate, severe, and worse pain. And then B is a 10-point pain scale, which 0 being no pain, 5 being moderate pain, and 10 being worst. And then here, C is the Wong Baker Faces pain rating scale. So this is stuff that you can use in like pediatrics if you have pediatrics, or if you have somebody that doesn't really know, okay, what a 5 feels like or an 8 feels like on the pain scale. You can say, hey, here's some faces. Um, this is no hurt, which is being 0. 5 hurts worse. You know, number 2 hurts a little more, and so you can use any of these three scales to determine a pain assessment. All right, here is a diagram of range of motion. So I told you that some of the information on the exam is going to be kinesiology. If we have time, we'll probably start going a little bit into the anatomy, the trail guide, um, the muscles and the bones real quick. But you'll see here, this is the joint movement measured in degrees. So there's a reason why I gave you guys that handout so that you guys can just take a look at that and understand. Even if you get one question and you kind of understand um, what that question was telling you, it helped. All right. So the joint movement is measured in degrees, and the system presented in measuring that uses 0 degrees as a reference point for the standard anatomic position, and motions of positions of flexion, extension, abduction, and medial lateral rotation are recorded as they move towards 100 degrees. So you'll see here in picture A, she's not fully at 180, but from 0 to 180 would be B. C is 30 degrees of the lateral trunk flexion. We look at D, that's 20 degrees of leg extension. And at the hip, we got 90 degrees. Obviously, if we were laying on the table, we know what 90 looks like. And then we got F, which is showing 10 degrees of dorsiflexion. And then G is showing 40 to 45 degrees of internal rotation. All right, so this here, how can I get this thing out? All right, so here, this is just assessment for fluid imbalances and landmark identification. So here, it's showing you the assessment for fluid imbalance and treatment, the landmarks that help the lack of symmetry. So if we look at, this is 1 through 10. So let me just grab one out of here. Um, Number 3, observe for decrease in muscle definition, bruising, tissue distension, and changes in color. If any of these are found, palpate or ask for the history. So, um, again, is this going to be something that you guys experience? Maybe yes, maybe no. We know that palpation is a way to assess our client. But if we take a look at number 5, palpate for heat and observe for redness and ask about pain. So here it falls under the category for assessment for fluid imbalances and treatment. So is your client hydrated enough? Um, if we notice any, redness or anything going on in the tissue, we can determine, can we treat or can we not treat? Number 7, if the area is not hot or red, determine whether the tissue is congested or swollen. So yes, this is going in depth. I wouldn't spend a whole day understanding this, but I would probably take a look at one or two, like I just did with you guys here, and say, okay, am I going to take my chances and spend my time studying this information, or is this just one of the questions I'm just going to get wrong? If I don't understand it now, am I going to understand it in the next 3 weeks? There's 100 questions. 70 is a passing score. You have 30. You can miss 30. I wouldn't recommend shooting for missing 30, but you can miss 30 and still pass the Mblex. Um, but then you guys got to start saying, okay, what are my strengths? What are my weaknesses? What can I spend time on? And what do I need to, you know, I can just look at it a couple times and I understand it. All right. Here, box 3.6 talks about the landmarks that help identify the lack of symmetry. Let me just grab one. The shoulders and the clavicle should be level with each other. So here, this is just our postural analysis. So we know if we're taking a look at our client, so we're using postural analysis, we know that the shoulders, if one is slightly lower than the other, then we know we have um, some asymmetry going on with our client. Let me grab another one. Mm, the greater trochanters, the knees and the ankles should be level. Again, postural analysis. The tops of the iliac crest should be even. So that's just the hand test. We wrap our hands around the waist and we put our hands around the iliac crest. We should determine with our thumb if one is higher than the other, then we got some imbalances. If they're even, the two thumbs are level. All right, here's just indications for referral. So again, let's see if I can come back to this chart. Let's see, we got contraindications. At one point, I used to go over, I would read each one, but I'll let you guys do that. So, like, we have the contraindications here with B. So, like, if we take a look at B, contraindications, site specific, pathology related, special populations, tools, special applications. So, if you're able to take this, break this down, you'll be fine. You guys will do way have no issues with this exam. All right, so if we take a look at indications for referral, if any of the following conditions are present, cannot be explained logically, and the client should be referred to the healthcare professional. So again, if your client's feeling pain, they're coming in with sharp, dull, achy pain, obviously we are not going to treat them. If they're fatigued, if they're inflamed, if we notice any lumps, um, and tissue changes, rashes, edema, changes in their habits, bleeding and bruising, nausea, vomiting. These are all things that we're going to say, hey, go see a doctor. I cannot treat you. All right. We don't want to be in a situation and not understand is um, what is what is indicated for a referral, and you're not referring that client out. All right. Endangerment sites. So this is in the Tappan's book as well. And you'll see here, these are some of the endangerment sites. Obviously, like behind the knee, and then we have the glands in the armpit. Obviously, the neck. We want to avoid that. So we got ED. We don't want to press down on any nerves. We got the triangle, the inguinal triangle right here. Um, let's see here. So anything that's compressing, like the median nerve, any of those things, the front of the throat, the neck, we want to make sure that we understand those endangerment sites. So as far as like your studying setup, if we take a look, oops, we take a look here. That's fine. I used to be able to find this quick. Let's say we find the endangerment sites. It's somewhere on this sheet. We go to endangerment sites and you click that and you're fine with the endangerment sites, put a check next to it. If you're fine, you're spending like 5 minutes, going over the endangerment sites. Where are you at? Contraindication, endangerment site. It's on here somewhere. But if you find endangerment sites, you click that and you're good. So you see here, I'm highlighting that. I'm good. Now I don't need to spend much time on that. And what's left that's not highlighted or not checked, that's what you keep going over and you keep looking at um, up until the time to take your exam. All right, so if we take a look, here just talking about the endangerment sites, I can't read pretty much most of the stuff that's here, but it's just saying like the medial epicondyle, the humerus, the lateral epicondyle, the sciatica notch, the inguinal triangle, the popliteal fossa. So in a nutshell, that just sums up all of the endangerment sites to go over. Moving on to the medical terminology. So if we take a look at the medical terminology, basically that medical terminology is about the prefixes. So one of the ones that we are used to is like itis. We know itis is inflammation, but there are some other terminologies that you might have to spend some time on to understand. So we all know what bi is double, circum is around, um, contra is against. If we look at epi is over, we got hyper, which is excessive, hypo, which is under. If we let's see here, semi is half, uni is one, supra above, Intro is into, within. Luca means white when we look at our pathologies. Mega, large, micro, small, and so on and so on. So again, spend some time on your prefixes for your medical terminology because it's gonna help you. You guys are gonna read a question and it may have a prefix in front of the word, and it will easily pick out the answer for you when you're reading the question. All right. And then here it just talks about the common root words and the common suffixes. I know it's small, so it's going to be hard to read it. All right, here's the common abbreviations. So let's find one. So when we're doing our SOAP notes, we have a chapter of that in our tapping book. In most cases, we're not writing out the full word of the meeting. Um, so you do have abbreviations. We are familiar with ROM, which stands for range of motion. So we know that. We know T, capital T, lowercase x is for treatment. Um, let's see here. Another one we might, BP, we know for blood pressure. So those are the ones that we know. Obviously, there's going to be some that don't stand out, and you can just spend. I wouldn't spend any more than 5 minutes going over the common abbreviations. OTC, we know it as over the counter. So you got to pick and choose what you want to spend your time on when it comes to your review, and you don't want to waste time on something that's going to be like one or two questions. So if we look at this, for example, I'm always going to come back to this chart. If if your strength, the overview of massage, let me just zoom this in real quick. So if we look at the overview of massage and bodywork modalities, cultures, and history, so 5% is 5 questions. So the history of massage and bodywork. You guys took that class. That was a wonderful Tuesday night class. You guys got a ton of information from that instructor. So if you know the history of massage and body work, this 5 question. If you feel comfortable with that information, then hey, you take your chances on the 5 questions that are going to be on there. The overview of massage and body work modalities. So you guys already know. You know what sports massage is, deep tissue, neuromuscular, myofascial. You guys know the handfuls. Again, there are a lot more modalities. If the test does throws a modality out of the left field, hopefully you guys could differentiate. Okay, I know neuromuscular, I know myofascial, I know lymphatic. Then this must be the answer. B, overview of different skill sets used in contemporary massage and bodywork environments. So here, 5% of the test is this. This is 5 questions. Um, hey, if you get two, two out of the five or 3 out of the 5, and you spent maybe 30 minutes or an hour or maybe a day reviewing this information, then you did a good job. But when you get over to the anatomy, where you got 12 questions on the anatomy and 11 on the kinesiology, that's 23 questions. 30, if you miss more than 30, then you're done. So those 23, you got to know this. You got to know, if we're here on the kinesiology, you see F, range of motion. If you know the definition of active range of motion, and you know the definition of passive, and you know the resistance range of motion, you put a check here, boom, you got this information. Joint structure and function. You may want to, look at what your book defines joint structure and function. But if we're talking about like the ball and socket joint, the hinge joint, synovial joint. So, spend some time on that. If you got that, put a check there. Location, attachments, origin, insertions, actions, and fibers, direction of muscle. The test is loaded with questions about D. So D is the one you're gonna want to highlight and say, I'm gonna open up my trail guide book and spend time on understanding the origin, the insertion, um, if something is superficial, if something is deep, understanding those concepts. Here, B, the concept of muscle contraction. So if they're talking about agonists, antagonists, understanding the difference between the two, the components and characteristics of a muscle. So that's the striations, the muscle fibers, the actin, the myosin, the filaments, understanding that stuff. So if that's what you need to spend time with, highlight that and spend time on that. When we look at the systems, so here we have the system structures and the system functions. So if we're talking about like the muscular system, all right, spend time on understanding, the muscular system and how it functions, whether that's the action, whether it's talking about, what's, you know, if we talk about what's distal, what's proximal, understanding that stuff, the tissue injury repair. So when we talk about when the tissue, when what happens to the scar tissue, how does the scar tissue rebuild itself? So you want to make sure that, oh, I highlighted that and stay high. You want to make sure that when you're reviewing this information, you want to go a little bit in depth of, reading what the question is asking for. If you do your practice exams and you read those questions, you might have to burst the question and say, wow, that was that question kind of tripped me up. What can I do to understand this question? And take the multiple, maybe the book that I'm gonna send you guys, maybe you can say, let me just do all the muscle tests. Let me do all the ethics, boundaries, laws, or regulations tests. So make sure you spend some time on that. Let's go back over here. All right, so here's just talking about the body segments. If we look at like the quadrants, so the upper, which is the right quadrant, the left upper quadrant, the right lower quadrant, the left lower quadrant. If we look at the body cavities, we have the thoracic cavity, you have the vertebrae. So these are the cavities. This is where your organs are sitting in. You have the cranial, and you got the abdominal, you have the pelvic. If we look at the vertebral column, we know uh, what the cervical, the thoracic, the lumbar, the sacral, and then we got to look at the curvatures. All right. So here's just a quick example about the abdominal quadrants. So you'll see here the right hypo, the gastric, the epigastric, the right lumbar, the umbilical, the left lumbar, the right iliac, the left iliac. So the way I like to remember this, we know that the iliac crest is right here. So we know that the left iliac crest is here, the right iliac crest is here. The lower back is right above here. So we got the right lumbar, left lumbar, the belly button's here. This is the umbilical. The epigastric is obviously when we talk about the stomach. So we know when we're chewing food, it makes its way here. So that kind of helps you knock out, one, two, three, four, five, six. The ones that you might have to try and remember is, number four and number three. All right, here it talks about like the surface anatomy. We probably get into this a little bit more um, when the we get into the trail guide information. But understanding the surface anatomy, whether it's understanding what the upper extremity looks like versus the lower extremity, um, knowing like our structures, like the bones, like the femoral bone, um, knowing like the digits, the digital, like the toes, understanding if like here, this is the temporal region. So a lot of the stuff will go the standard anatomy, and then sometimes it will jump into the anatomy and the physiology. So like the anatomy lecture and then into the anatomy lab. All right, here, very important. This should not take you guys more than 3 minutes. Um, whether you're looking at the picture or just understanding what the frontal the sagittal transverse plane. So your trail guide book has a good information on this. If we look at the sagittal plane, remember we had the sagittal, mid sagittal. Um, so that's set giving you the right and left halves, and then we have the frontal plane, which is the front and the back, and the transverse is the upper and the lower. All right, again, movement terms. So this stuff is in your trail guide. So we got the adduction, abduction, internal, external rotation, flexion, extension. Um, Even the tricky questions will talk about the thumb. Like we know that the thenar, the hypothenar, the pad of the thumb. Um, those are the things that will pop up on these tests, on these questions. So whether it's something like the opposition that we learned, those are the things that you got to understand what's going on. All right, here's just giving further information on like knee flexion, knee extension. A question might say, the individual is moving their limb away from the body. We know that's abduction. They're bringing it back in. We know that's adduction. All right. And here's just talking about the elevation, depression. So all the stuff that's in your trail guide book, you can move from there. All right. Moving on to the structures of the body's tissue. So here's a diagram of all the structures of the body's tissue. We got the blood, the epithelial tissue, the elastic cartilage, the fibrocartilage, the hyaline cartilage. Um, if we look at the loose areola connective tissue, we got the cardiac muscle, the striated muscles, the smooth muscles, the bone, um, the fat. So these are the structures of the body tissue. um, Again, you're gonna have to spend some time on that. Not a lot, but spend some time on it. Here's the joints we were just talking about previously: the ball and socket joint, the gliding joint, saddle joint, pivot joint, and then the hinge joint. So once you're taking these questions and you're doing using the app, you're going back to reviewing your course material. A lot of this stuff is gonna stick. And a lot of it you're gonna have to just remember. It's like a memorization until you understand it. But again, remember, you're filling up your memory bank to take this exam. Once you sit down, now you're concentrating on using what you remember. But keep in mind, people will study and study, and they sit down and take the test, and questions are way harder than what they studied for. Then you're gonna have to use let me look at the answers first. Do I understand any of these answers? And then start figuring out the process of elimination, getting it down to your choices, your two choices from the four selections, multiple choice selection. All right, here's a little bit more on range of motion on the table. So we know 110 to, I would say 120 here has 125. It's beyond 90 degrees here of hip flexion, and then we have the hyperextension. Here it's going beyond that neutral range, which is 0 to 15, and then you got the hip abduction, and then you got the adduction here. So 0 to 45, and hip adduction is 45 to 0. So neutral is usually with both legs laying on the table. D is hip external rotation is 0 to 45, taking that leg out. And then medial internal rotation is from 0 to 45. And then knee flexion, you'll see um, 0 to 130, and knee extension is 120 to 0. And here's going on at the lower body with from the knee to the ankles, eversion, inversion, flexion, extension with the hands. All right, so this box here, box 4-1, joint movement. If you guys can read this and understand this, then that's all you need to review for joint movement, because the question will have this terminology in there. You know, whether it's increase the angle, decrease the angle, move away from the midline, move towards the midline. So when you hear that terminology, it should, you should zone you in on that answer, if you understand that terminology. A lot of the times you're going to have to like visualize what the question is talking about. So if you hear turn the palm or foot upward, then we know that's like supination. All right. If you hear lower the foot, pointing the toes away from the shin, then we got plantar flexion. Let's see here. The muscle contracts, its insertion is pulled towards its origin. The origin is generally. Oh, okay, so here, when a muscle contracts, its insertion is pulled towards its origin. The origin is generally closer to the midline of the body, and the insertion is farther away. All right, let's see here. Get back here. All right, so moving on to the first thing I wanted to cover with you guys, and then we'll do like a 25 question quiz, participation with everybody. Um, but I just wanted to just briefly see if I could run through some of these, some of the anatomy, because, like I said, you got 23 questions, and you want to make sure you understand what's going on. So if we take a look at chapter 2 in your trail guide book, chapter 2 talks about the shoulder and the arm. Let me make sure. Yeah, the shoulder and the arm, and obviously the bones. Some of the terminology, you're gonna have to understand, because a lot of the questions are gonna talk about, like the scapula, the humerus, the clavicle. Um, so these are things that you guys want to make sure that you understand. Again, hopefully you guys kind of got the gist of this. But if you guys can remember, we talked about like the superior angle, the medial border, the subscapular fossa, the inferior angle. Um, then we went into the spine of the scapula, the infraglenoid tubercle. So a lot of the muscles that you guys are going to be, the questions that are going to be on the exam about the muscles. Whether you get 15 questions or you get, 20, 23, at least you guys will have an understanding. If it's talking about the scapula, you guys will understand like the supraspinatus muscle. We know that it's in the supraspinatus fossa, the infraspinatus muscle, the infraspinatus fossa. We got the muscles that attach to the spine of the scapula. We got the lateral border of the scapula, where we got the teres minor, the teres major, and then we know the lats come in here. So just understanding, spending, I would say, spend a couple days on this when you guys are reviewing on your anatomy. If we come here to the humerus, we got the greater tubercle. So there's a couple of muscles that attach, there. We know the rotator cuff muscles. You got the lesser tubercle, the deltoid tuberosity. So we got the deltoid muscle that's um, right up here, and then we come down, and not to say that you might get a question that's asking about the medial or the lateral epicondyle. Hopefully, when you're studying, you guys will remember that. If we take a look at the posterior view, the olecranon fossa. So some of these stuff should be able to stick out with you guys when you're reviewing, or you're taking like the sample questions or whatnot. We have here the acromial end, the sternal end. We know the sternal end is closer to the sternum based on the name. The acromion is next to the acromion process. If we look at the landmarks, the bony landmarks, all right. An example like this is a quick way to get your studying on the bones of the shoulder and the arm. If we get into, the muscles. So if we look at the muscles of the shoulder and the arm, we got the traps, the deltoids, the rhomboids. Some of the questions are going to be, a lot of them are going to be insertion, the origin, and insertion. The origin of this muscle, the insertion of this muscle. So it's gonna stump you a little bit if you guys don't spend that much time on that. So here is giving us a lateral view where we see the lats, the teres major, minor. Um, it's kind of like you're gonna have to go back over the anatomy lab and spend your time and going over that. If we look at the actions, so we see here flexion. So you might have a question that says this muscle is involved in flexion at the shoulder, and it might give you the choices where it might say the deltoid anterior fibers, one selection, and then it will say the rhomboid major, and then it will say the latissimus dorsi, and then one crazy answer would be like the hamstring. So we know with the process of elimination, we know the hamstring is not a muscle that's involved in flexion at the shoulder. All right. And when we look at our choices, we can be confident that the deltoids, the anterior deltoids, are involved in flexion of the shoulder. Whether you remember these muscles, but just by palpating and kind of visualizing those muscles, you should be able to say, yeah, I know this selection is a good selection. All right. Here we have extension. You can get a tricky question on this, but if you can visualize extension and kind of remember what muscles are involved in this, we know that the lat dorsi play a major role in extension, and hopefully you guys can remember that. Here we got questions that can stump you is like horizontal abduction, horizontal abduction. So this is where you're gonna have to say, I gotta position my hand. Hey, if you gotta stand up in the room, stand up and do the movement. Go ahead and do it. If to get you to get the question right, I would do it too. Here we got lateral, medial rotation, interchangeable with external and internal rotation. So again, terminology that can be used vice versa to kind of stump you on these exams. So spend your time on this as you are reviewing each chapter of the test. All right, let's take a look at the individual muscles. So here we have the deltoids. Another way we can look at this is, okay, I know visually what the deltoids look like. Do I remember if there's an anterior, a middle, or posterior? If I don't remember, let me just make sure I go over it and remember it. Um, if we look at the origin, the lateral one third of the clavicle, the acromion, and the spine of the scapula, a lot of your questions will detail the origin like this, and you're gonna have to kind of break down that question where it says lateral one third of the clavicle. So now you're kind of picturing the clavicle, and you know that this muscle comes out, starts one third um, the distance of the clavicle, and it comes out laterally to the acromion process, and then this muscle comes all the way around because we know the spine of the scapula makes its way to that acromion process, and now this muscle wraps around there, and it's along the spine of the scapula. But the dead giveaway, if you can find a way, and it's going to be in the question, would be the deltoid tuberosity. So now you have these three muscles that attach on this deltoid tuberosity. The minute you see deltoid tuberosity, you should know that, okay, whatever those selections are, if deltoid, whether it's the anterior, posterior, or the middle deltoid, I know for a fact that it's one of those three because the insertion is the deltoid tuberosity. So that's where your confidence in your studying and understanding, um, what muscles are the question is asking for the muscle. All right, if we look at the traps. Okay, same situation like the deltoid. You got the lower, middle, and upper fibers. Obviously, this is a muscle on the posterior aspect of it. Here comes the trickiness with the trap because the origin has, the external occipital protuberance, the medial portion of the superior nuchal line of the occiput. So it's pretty detailed. Um, if there's a way that you could remember it, maybe use the insertion, or if it's a question that's not that detailed but it gives you the action. um, you might see, what's a good one, depression of the scapula, upward rotation, um, you know extend the head and the neck. You can do process of elimination. Again, some of the answers are not going to be um, even relevant to what the question is asking. All right, let's get to teres major and teres minor. Again, this is one of the tricky ones here, because if you understand, some of these muscles actions, you'll be fine. So whether you understand the immediately rotates the shoulder, or if you know that this is the muscle that's in between, that's the major in between the two lats. So you got the pec, you got the pec major, the latissimus dorsi, and then you got the teres major. Then you got these three muscles that are the only three muscles that are on the crest of the lesser tubercle of the humerus. So again, finding out a way to remember this or understand it, or if you just want to remember the rotator cuff muscles and know that these muscles are what muscles are part of the group and what muscle is not a part of the group, is another way to remember that. So if we look at the supraspinatus, the infraspinatus, the subscapularis, all right, and the teres minor. Where's our teres minor? Oh, there it goes. And then our teres minor. So we know that group is a part of the rotator group. Um, so we know that the teres major, which is not a part of that group, is the helper for the latissimus dorsi. So those little things you can try to remember to get you through on these muscle questions. Let's get another good one. The rhomboid major and minor. So a lot of times you will read a question and, like, for example, we got the major, which takes up a good portion of this middle aspect, of this medial border of your scapula. And then the minor is a very small muscle that sits above the major. So if we take a look at the origin, um, for the major, T2 to T5, um, if you can remember that, that's in the thoracic region, and the minor is C7 to T1. That's only two spinous processes versus um, the spinous processes that we have here was roughly three. We can kind of guesstimate when we're reading a question if the question has the origin of the major and the minor, and your selections are major and minor. You could kind of, if you can, remember that the minor is less, the origin is less than the major, then that could probably help you answer that question. If we're looking at the insertion, we know that both of these muscles insert on the medial border of the scapula. Um, and you'll see here, this is between the spine of the scapula and the inferior angle. So another keyword, we got the inferior angle, which is lower um, than what the teres, the rhomboid minor would be. So that can be a giveaway right there. So here we see the insertion, the upper portion of the medial border of the scapula across the spine of the scapula. So the minor doesn't say inferior angle. So if you have a selection and if you can't remember anything, one of the key words that will help you get this answer right is the inferior angle of the scapula, and then maybe the origin where this is just two spinous processes versus three. So I'm just trying to give you guys some tips, whatever comes to mind, and remember that. Let's see here. All right, pec major. So another thing with the pec major, if and you guys, it's gonna be hard for you guys to remember every muscle's origin insertion, but if you at least know where the muscle is at, and if that muscle contracts, we know that the insertion is always going home to the origin, so it's gonna shorten. It's gonna go towards that origin. So if we take a look at the pec major, we know it's on that humerus, and this is the crest of the greater tubercle of the humerus. Now with the pec, we know there's multiple. We have two. We got the upper and the lower fiber, um, and in some books they have the upper, middle, and lower fibers. Um, but you know that the upper fibers at the clavicular, then we got the sternal, all right, and then the low ones would be you know, towards the bottom of that sternal region. Let's see here. Let's look at this. All right. Another thing you have to keep in mind, if you guys remember when we talked about the pec minors, you got the brachial plexus. So if you do get a question about numbing in the upper portion of the shoulder, it could be in the scalenes, which is in the neck. That can be one because we know that the brachial plexus makes its way in between the anterior and the middle scalene. And then the second option on that compression could be that pec minor. So keep that in mind. Let's make our way down. Tricep brachii. So again, terminology. Tri means three. You got three heads here. One of the let me zoom in here. So if we take a look at the origin and the insertion. So let's take a look at the insertion first. So the olecranon process, um, we know that the olecranon fossa is in the humerus, and then we got the olecranon process, which we know is the elbow. Um, again, if you don't know that at this point of the course, you're gonna have to spend a lot of time on going back over this chapter. But that should be like I wouldn't say a dead giveaway, but a giveaway for you guys to understand. Okay, we're dealing with the tricep muscles. But if we take a look at the insertion for the tricep muscles, but one of the ones that can be tricky, I would say like the infraglenoid tubercle for the long head. So let me just zoom in here. So if you remember when I'm zooming in too much here, but when we just went over the bones of the scapula, up here there was the infraglenoid, tubercle. So we got that little point right here. This is the infra, and then we had the supra on the top. So you got the teres major, minor, and then you got the long head of the tricep. Let's see what this picture. This will give. Yeah. So this one right here is giving us a better. You see right up in here is the long head, and then here are the other muscles of the tricep, the other heads of the tricep, where they originate. All right, coracobrachialis is another a muscle. Again, hopefully you guys will understand. Okay, if they're talking about the origin and insertion, let me break down the name. I may not know the origin and the insertion, but if it's has coracoid or the coracoid brachialis, I'm gonna take my bets with if coracoid process of scapula is one of the choices. I'm gonna hedge my bet on that. So in some cases, you may not know the origin and the insertion at all for the muscle, but if you read the muscle and you look at your choices, your selection, there's a good chance you would get that right. All right. Let's whip through this real quick and then we'll do the practice test and then I'll open it up for you guys. All right, so chapter 3, forearm and hand. Again, we got the humerus, which is proximal to the forearm and hand. We've got the radius and the ulna. The ulna is on the pinky side. The radius is on the thumb side. So figure it out. How you're going to remember this. Is it pinky and ulna, PU? Whatever way you need to remember it to make your studying a lot easy. You're going to have to dust off your trail guide book from last semester and dive into this because we look at the percentages. Again, if I'm not sharing the screen, but if we look at the percentages, we know that there's a chance you might get 15, you might get 10, or you might get 20 questions that are in regards to the anatomy, whether it's origin, insertion, the kinesiology, whether it's, flexion, extension, um, internal, external rotation. You might get something on the joint, ball joint, hinge joint, so you're going to get something in reference to that. I'm not sure if we have that in the little quiz we're going to take, but there's going to be something related to that. Here, carpals, 8, metacarpals, 5, phalanges, 14. All right, so this is the anterior view. So we know we got the flexors and the extensors. Um, so we know we have, where these muscles are located. If we get into the wrist, um, of course, we got the carpal bones. You might even just get a question on just carpal tunnel. All right. So understanding, okay, carpal bones and understanding the structures of the radius and the ulna, um, plays a big part. We know that the shaft of all the bones, all long bones in the body, we know this area is the shaft. Whether it's the shaft of whatever bone. So this here is the shaft of the radius right here, and then you got the shaft of the ulna. All right, let's roll. All right, so if we take a look at the muscles of the forearm, again, the major thing is the flexors and the extensors. Luckily for us, the forearm kind of helps us out with the names of the muscle. If there's a supinator, it's going to have that name supinator. If it's a pronator, it's going to have pronator. If we take a look at the actions, all right, whether we're looking at the anterior or posterior view. But if we look at some of the major actions of the forearm, so flexion, extension, we know that the muscles that assist in these movements are synergists. They're assisting. We know agonist is the prime mover, antagonist is the opposer to that movement. All right, so while one is moving, the other one is relaxing. They cannot move at the same time. All right, so we look at flexion. Primarily, we have the bicep brachii, the brachialis, the brachioradialis. All right. If we look down here, we have one of the flexors and some of the extensors assisting in that movement. With extension, we know the tricep brachii, all heads. You have a small muscle known as the anconus that's involved in that movement as well. When we get here to supination, pronation, um, we know that if we have a selection of choices, if the supinator is not in there, then we gotta kind of remember that the bicep brachii are involved in supination as well. With the pronators, we know that we got two options that have the name pronators in there. The brachioradialis assist in both movements. If we take a look at the wrist, we got extension and flexion at the wrist. Luckily, like I said, for us, a lot of the anatomy terminologies or the name of that muscle is going to be similar to what the action is. All right. So if we take a look at extension, extension is all the extensors. If we look at flexion, and flexion is all of the flexors. All right. Let me get to. I just wanted to show you guys one thing in here. So I'm not gonna run down the flexors and extensor muscles. Like I said, it helps you guys a lot to know that the name kind of tells you what the action is. But there was one thing. All right, let's get right here. All right, moving down to the hand. So if we look at the hand, the short muscles of the thumb. So you'll see here the opponens pollicis is a muscle of the thumb. If we get here, so all of the muscles for the thumb, it's gonna have pollicis in it. If we look at the muscles of the thumb versus, the muscles of the pinky. Um, but one of the things that we want to make sure we understand is like this area of the thumb. You got the thenar eminence and the hypothenar eminence. Pay attention to understanding what that is. Go over that a little bit. If we look, for example, here, hypothenar is everything on the pinky side. So everything on the pinky side is a hypothenar. So you'll see here, mini me, mini me, mini me. Thenar is everything on the thumb side, like the thumb pad side. Let's see here if we got anything. So you said the thenar muscles. Let me zoom in here. So that's all on the thumb side. So the thenar muscles are on the thumb side. All right. So these are the thenar eminence. So you got like things like that will stump you on this test if you don't remember, thenar, hypothenar. So understanding that. Like I said, some stuff that will come up on that test that we didn't, get to go over in the lecture or in the lab. Here, you'll see that fascia, that thick fascia that surrounds all of the tendons, the flexor reticulum. So remember when we looked at, you know, what happens when you cut this and what happens if there's inflammation, that's the flexor reticulum. All right. Let me pull up here. Okay. All right. So we're gonna run through a little bit of the quiz. I am not gonna answer anything. I'm gonna have you guys answer it. Um, and if I need to explain anything, I will explain it. But let's just see. Is there something that catches you guys is while you're reading the question, and can you answer it right away, or do you have to think about it? All right. Irish it quick. All right, so the first one we have everybody answering A. So maintaining professionalism and professional boundaries may be more challenging in which of the following setting? All right, so everybody selected. Did Anthony select? We got Irish. Anthony, yeah, Anthony, you jumped on at the last. All right, so let's. Oops, you know what? Let me do this. Give me a second. Let me share. Let me pull this up, and then I'm gonna share so that we could do it. Give me 1 second. Let me pull it up. Where are you at? I wanted to share it so it's more interactive. Let me give me 1 second. Oops. Because I noticed it's not. Let me see something. Yeah, it's not letting me. All right, cool. So let me come out and share. Hmm. All right, yeah, let's share that one. Oops. Give me a second here. All right. So, so you guys can see it, right? I hope you guys can see it. Just say, yeah, I can't see it on my end because I have it in full screen. So just say, somebody just say yes, just a voice. I can't see the
Yes.
replies. Okay. All right. So let's see. We got A. Oh man, that's loud. Let me actually get out of this. You know what? I'm screwing the pooch. Let me. Uh, Give me 1 second. Where is it? Bum, bum, bum. All right. All right. Number two, the facet joints of the spine are also known as. What do we got? I'm about to get out so I can see you guys. I'll stop sharing. Let me. Hold on. Let me. Where am I? Where am I? Man, I got so much things open, bro. All right. Let me expand this. Let me get out of this real quick. Sorry guys. Cause I can't see your replies. I'm gonna have to do it the way we did it the last time. I know what I can do. I'll just do an applause. All right, let me get to that question number two. All right, so we had D. Let me minimize. Oops, I'm still sharing. This thing got me. Let me bring this over here. All right, so we got D, the transverse process. Hold on. Why do I got two screens? Give me a second. Why is it showing two screens? Minimize this. Get this out the way. Let me get this.
Hmm.
This thing is loud. Hold on, guys. Let's see. It's sharing. Why is it sharing a double? Am I still sharing a screen?
I don't see anything.
You don't see anything? All right. For some reason, it's doubling my screen. It's doubling. It's messing me up. Sorry about that, guys. Let's see. I wish I could. All right, let me do this. I'm going to pull up, double it up, pull it up twice, pull it on the side. All right, and let me lower the volume so it doesn't blow our ears off. All right. All right, so for number two, everybody selected. Let's see what everybody had. What you guys select? The fossa joints of the spine that are also known as, and what you guys select? Let's see. 'Here. 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 ' All right, so everybody had a transverse process. Let's go to the second one. Third one. All right, number 3. Which of the following syndrome causes swelling of the muscle in the lower leg, resulting in impingement of the neurovascular structures? That's it. All right. So if we're talking about the leg, um, which of the following syndrome causes swelling of the muscles in the lower leg? The key thing here, we're looking at the muscles in the lower leg, so it's in the leg itself, resulting in impingement of the neurovascular structures. If we get down to like the tarsal, we're just talking about the foot area. So we that's a process of elimination. The piriformis, we know it's in the glute, and then C would be the best answer. Restless leg is a syndrome, so the compartment is C. So that would be, and that's just coming that comes from you just reading, one of the just it comes across as you're reading something, you never really think about it, but that would be the best possible answer. So for that one, we would applause to that. All right. Deciding whether to take on a client, number 4, who's a friend, requires what? I don't know why my screen is shared. Yep. So everybody got it right. So it's that boundary. You want to have that boundary between you and your client, um, because permission from a state or local board, the practitioner to make the special, none of that requires that. To take on a client who's a friend, you just want to make sure you have that boundary. All right, number 5, which of the following assessment is used by a practitioner to observe how a client walks? All right. So keyword is walk, gait. So that's so you see some of you guys are gonna be able, it's gonna stand out. It's gonna stand out. I gotta take my son to practice. Which movement will lengthen the fibers of the QL on the right? So this is a little tricky. I know the answer to this. Let me make sure I take care of y'all on the last one. All right. Um, so which movement will lengthen the fibers on the of the QL on the right side? Oh, this one makes you think. All right. So if we take a look at, it's not elevation, all right, and it's not extension of the vertebral column. So it leaves you to B and C. So if I was to do lateral flexion to my right side. If you stand up and you just, or in your seat, just lateral flex to your right side, is that lengthening the QLs or is that contracting the QLs? All right. Now, if I laterally flex to my left, what's happening to your right side? Is it lengthening or is it contraction? So we're only focusing on the right side. So if I was to lateral flex to my right, what's happening to your right? You're contracting that muscle to the right. So you're making it shorter. All right. The question is asking about lengthening the fibers on that right side. So C would be the answer. All right. So C, lateral flexion is lengthening that right side. That's number 6. All right. Which of the following external forces is best used by the practitioner to elongate the soft tissue? Let me check something real quick. So you guys take it answer that. Let me check something real quick. What's that number 7? Let's see something right here. Wow, why is it so loud? All right, give me 1 second. I just gotta check something. I see all answers, but give me 1 second. Why is it so loud? All right, so for this one, it's a little bit tricky, but the answer is B. Um, shearing is if you take a look at the question, which of the following external forces is best used by a practitioner to elongate? If we take a look at that, I just want to confirm if I can find it. Give me a second here. I ain't gonna have time to go over that, but we'll just remember number 7 next week when we go to class. I could explain it. But all right. So it is tensile is the correct answer. Um, but if we again look at the what's going on, A and D, of course, are out of they have nothing to do with that question. So process of elimination leaves you with the option of B and C. So go ahead, jot down tensile and shearing, and we'll come back to that. Um, we'll go back to that later on next week. Let me just see if we can get 10 out of you guys. All right. One component of the proper body mechanics is to go ahead and read that. I don't know why this volume. Ouch. This thing. All right. Let me make sure everybody answered. All right. Yep. So one component of proper body mechanics, and it's kind of tricky because, like, obviously, I'm looking at C, utilize the back of the foot to support the practitioner weight. That's right too. But A, stabilize with the front foot while performing the long strokes can be 1, 2. So for me, you know, it could be A or C, but we can go with A with this one. But this is a little tricky one because C is correct too. What just happened? C is correct too, where because remember the back foot, if we take a look at those pictures, are utilized to support the practitioner's weight. Keep the feet and hips in a symmetric stance. We know that that stance has to be kind of like the archer stance or the one foot in front of the other. Remain in neutral position throughout the set. We know B is completely not, an option there based on that. All right, so we'll go with A. All right, number 8. All right, number 9. All right, which movement will shorten the fibers of the rectus abdominis? So this one you guys should answer pretty quick. All right. So just think of that movement. Yeah. All right. Yeah. So flexion. All right. Number 10. The term pronator refers. You guys getting a bunch of anatomy questions. The term pronator refers to which of the following characteristics of the muscle? So everybody, exactly. So all right. So again, a lot of remember as you get questions right, the harder the next question is going to be. The harder the next question is going to be until you get it wrong, then it's going to go back to easy. So if you guys noticing that your questions are getting harder and harder, that means you're getting them right, right, right. And if you get an easy question, that's kind of a sign that you guys got the one before that maybe wrong. All right, a term of overuse condition that affects the anterior or posterior regions of the lower leg is, this is an easy one. So, got Shinspin. So keywords, overuse. Um, then we got anterior or posterior regions of the lower leg. So remember you got the anterior tibialis, and then you got the posterior tibialis, where your client could feel pain in the anterior compartment of the lower leg, but then also in the posterior compartment of the lower leg. All right, tarsals is the ankle, piriformis is in the butt, gout is in the foot. All right, let's get here. All right. What component of the therapeutic relationship would the practitioner make an effort to decrease in order to encourage a client-centered connection? Tricky question. Tricky, tricky. Everybody selecting D. Uh, I want to confirm this one. All right. So the answer is C. Power differential. So you guys got to take a look at that, write it down. All right, take a look at that power differential. Read it up, look it up, and we'll go over this. Iris or Camille, write down number 7 and 12. We can go over next week. All right. Let's move on. We got 13. All right, 13. A practitioner performing superficial strokes on a client creates what type of effects? Tricky question. It's another tricky question. You might as well write this one down too. This one got me stumped. I want to go at one, but I know what the answer is. See, that's head. Yep, see, so we know thermal's out of the question. Yeah. All right, so this one's a little tricky, but oh, Iris got it. I don't know if I should give you. It's D, reflexive. So put 13 down. We gotta go over that one. That got me because I had A first. Um, 14. So we want to go over these questions so we could better understand them. If you guys want to jump ahead and go over it, and then we could talk about it in class, let me know. Which of the following muscles form the cap of the shoulder joint? Hey, we all got that one right. All right, 15. Which of the following joints allows the most movement? Tricky, tricky, tricky. This one is tricky. I'm gonna tell you right now. Oh, one person got it right. All right, so that answer is B, acetobellofemoral. So we'll give Iris and we get the rest of y'all. All right, so sacroiliac, there's very minimal movement in that sacral joints and the symphysis of the pubis. So C and D, there's very slight movement. You're left to A and B. This A says occipital in it, so we know that there's not too much movement over here. If we look at B, it has femoral in it. So that would be our best choice there. All right, 16. A new client presents with the diagnosis of thoracic outlet syndrome. Which of the following would be a common complaint? Tricky one or two. Tricky, tricky, tricky. So you just got to do process of elimination. Process of elimination. Are those the two you eliminate? So thoracic is, we know it's in that, anything in that. All right, we got two. All right. So the answer is C. We could eliminate the diaphragm. Um, diaphragm is close because we're in that thoracic region, but definitely the leg. The shoulder blades is above that thoracic region, so you're down to A and C. But with the thoracic outlet syndrome, it's one of the ones where we talked about the brachial plexus running down the neck. It's one of the ones that could be compressed, causing a thoracic outlet syndrome. All right. So again, 50-50 on that one. I'm not going to stress that on you guys too much. All right. Which of the following structures is responsible for detecting the amount of tension within a muscle? So again, this one can be tricky as well if for you guys that haven't taken any of the anatomy, and even for you guys that have taken the anatomy, this can be stressful. I'll give you a little help. It's the key word is detecting. Detecting. So we talked about that last week. If we're holding the weight in the hand, it drops. So detecting the amount of tension is the key word. All right. So we know that when it comes to detecting, yes, the Golgi tendon is the one that picks up on that's the detection, whether you drop the weight or not. The Golgi tendon is the one that picks up on that. All right. All right. Number 18, a chiropractor writes a prescription for a patient to receive 30-minute massage sessions once a week. The session should be focused on the cervical area. During a scheduled session, the client asks the practitioner to work on the lower legs and feet because she went for a jog earlier. What is the best course of action for the practitioner to take? So you work for a chiropractor, you're not doing your own personal, and he gave you a prescription. Yep. All right. So we know A is the answer to that. Yep. Cairo gave the script. So you're rolling with the Cairo. All right. Another tricky one if you guys haven't been doing your studying. But after today, you should know what this means. So the acronym for HIPAA stands for. Camille, you answered it twice. So everybody got C. Let's see here. We got one person got B. All right. So health information, portability, and accountability. I got C. All right. And let's wrap this up with number 20 because I got to roll. So I owe you guys 5 more questions. We'll do that beginning of class next week. All right. Which of the following components of a business plan comes first but should be written last? So this is tricky because we didn't go over business. So if you want to answer this, you can. All right, so this one is the executive summary C. So we'll go over that one. Let me throw another one at y'all because that one was a little tough. All right, last one. Which of the following muscles form the anterior border of the axilla? So here's the anterior. So that's the front of the armpit. So say your client is supine on the table, you have the arm and the arm is abducted and you grab that portion of muscle just above the armpit. What muscles are you grabbing? So remember the serratus anterior. Yes. All right. So serratus anterior is along the ribs. You are yep. Pec major is a good job. All right, guys. So we'll shut it down at 21. I owe you 4. Any questions, just message me in the chat. Um, I'm gonna put up tomorrow's class. You guys are gonna do the business. Um, what is it called? Hold on. We're gonna get started on the business so that we can do. Do you guys want to do another MX part 2 of this review? Or are you guys good? Let me know. It's a lot of work to get it ready for you guys. So you guys want to do it or you feel comfortable with what you learned today, let me know. All right. So career path quiz will be posted on on Canva. And let's see here. Man, everything just I never use this tablet and everything just crashed. I got so much information in here. Now it doesn't want to bring up anything. All right, so I'm probably going to put career path quiz for tomorrow's lecture on for tomorrow on Canva, and I might go ahead and start reading chapter 26, and then I'll put all the business stuff up, start reading chapter 26, and I might put a video up for you guys to go over tomorrow. Next week we'll knock out the cupping, get that cupping stuff out of the way. Probably go over a little more questions on the Mblex and answer any of your questions on the career path. So we'll do a combination of career. We'll start the business, do the cupping, since we're meeting in person, and then we'll prep for the following week, next week. Let me see. This thing froze. Oops. Give me a second. Let me see what I had open up recent. Modalities. So what did I have? Yeah. So next to tomorrow, business practice part one. So I'll put all the business information up and career path quiz. Then next week we'll go into cupping, answer any of the Mblex review part one stuff, and start reading chapter 26. Your test three is on chapter 26 and 27. So if you want to get ahead, read the business stuff because that stuff is on the Mblex. All right. Um, if we're good, everybody's good. Give me a thumbs up, and you guys can have a good night. Give me a thumbs up before you exit. Exit with a thumbs up, so I know everybody's good. All right. All right. One more, and we good. All right, guys. So take care.